Hello, dear friends. Good morning and welcome to this session. You need to pay attention to this story. You need to give me few minutes of your time in order to listen to this story. It might be a life-saving story of an experience a patient had, and it's one of the common issues with women, which I believe if you hear would assist you or assist somebody you know in where you live and within your neighborhood, right? So pay attention. Now the story goes this way: a lady who is about 40 years, she has had 3 pregnancies in the past, became pregnant, and at about 8 weeks of the pregnancy, she started bleeding and had miscarriage, right? She went to the hospital near very close to her place. The hospital, she met a doctor there. They carried out some investigations and said that she had a miscarriage. In fact, that she was having incomplete miscarriage, and then eventually she had evacuation done, right? Now, right from that evacuation, she kept having small bleeding, and then she was encouraged to exercise patient that the small droplet of blood, that it's going to stop with time. Okay, now she exercised patient and they gave her some medications with respect to that. Now over time, like 2 weeks after that evacuation, the woman continued to have vaginal spotting. In fact, on a particular occasion, she said she bled and was passing what she described as brownish discharge, and then she went to hospital again, and the same hospital, they told her that she's going to have the womb washed again the second time. So she had the womb washed again, what we call evacuation. Manual vacuum aspiration was done for her the second time. She bled during the procedure, but not necessarily to need blood transfusion. So at the end of that procedure, they now gave her some medication. They gave her drugs that can make the uterus to be firm in contraction, and then gave her some antibiotics. Now down the line, about 2 weeks later again, she noticed that from the second evacuation till 2 weeks after, she still was having droplets of blood, vaginal discharge, and then this time around, the abdomen was now beginning to get enlarged. She was now having low abdominal pain. She noticed that the low abdominal region was getting a bit swollen, and she got worried. She went back to the hospital, again, and they told her, "Madam, I think you need to go to a bigger hospital." So the woman came to our facility, and then we took a history of her, examined her, and then sent her for important investigations that she could do. We did a scan for her and noticed that she had enlarged ovaries. The ovaries are already enlarged, and then the uterus, the womb is already enlarged too, and then the womb is already filled up with a lot of contents. The contents are, it's like it doesn't give appearance of a baby, so to speak, but the uterus is filled up and enlarged. And then we looked at the vagina. There were a lot of blood was coming out, and then something that resembles foam. You know that foamy stuff when you are washing clothes. That foamy stuff that comes out, that helps you to wash your clothes. Those are the things that were coming out from the vagina, mixed up with something like grape. That appearance when you cut off when you cut the inner aspect of an orange, that kind of appearance. These are the things with blood. These are the things that were coming out from the woman's private part. So we now sent her for scan. The scan also revealed similar thing. We sent her for a pregnancy test. Pregnancy test also supported that she's been pregnant. In fact, there's one we call beta HCG assay. We sent her for beta HCG assay, and the value was so high, you know. So eventually, which is the main reason I started telling you this story. This one was diagnosed with gestational trophoblastic disease. What is gestational trophoblastic disease? And the gestational trophoblastic disease she has is not just a benign type, it is choriocarcinoma. Now, this choriocarcinoma is a component of gestational trophoblastic disease. But the good thing about it is that once it is properly treated, the treatment is done to have suction evacuation. Once you have suction evacuation and then chemotherapy, once these treatments are given to the patient, usually they respond, they are very chemosensitive, they respond to treatment very fast, and the patient may recover 100%. So that's the story I wish to tell you. So why I started telling this story is that whenever you have miscarriage and you are still bleeding, please don't say that this miscarriage is just miscarriage that is going to clear with time. No. Try to go to a gynecologist to review your condition and give you suggestions, suggestions of what you should do. Don't wait until the condition gets prolonged and gets complicated. Now, that is the essence of this story. I hope it has helped somebody. Please don't keep it to yourself. Try to share it with your friend, because this might be someone might be going through this and may not know exactly what it is, and it is not demon that is causing it. It is not a spiritual attack. Yes, I can tell you for sure. All right, please help me to share this video and follow us on Facebook and YouTube. Thank you. Catch you on the next one.